In our educational videos, we've talked a lot about post-operative management of pain, and some themes have included to minimize narcotics, for example, to maximize other kinds of therapies, and to have an optimistic approach. Steve here has developed a very specific regimen for management of postoperative pain that he has called BRINE, B-R-I-N-E, and I think it's a fabulous, innovative example. Can you talk a little bit about what this program is?
Yeah, I came up with BRINE a few years ago, sitting in a patient's house trying to figure out how to help them understand to get off their pain medications, how to help them do some of their, take an active part in their healing process. And BRINE is an easy way for patients to take an active part. When you go into the hospital, you lose a lot of independence. When you come home, you don't know exactly what's going on as a patient. You have a lot of medications. And by developing BRINE, I've been able to help patients work with me in the home. BRINE stands for breathing. The B stands for breathing. We know that after surgery, they're on anesthesia and they're often on narcotics. Narcotics are a respiratory depressor and anesthesia as well. A lot of different medications have those same side effects. And by using deep breathing, it helps to bring the body back into a natural balance. It helps to combat those side effects of those medications. Our body also gets really stressed out after surgery, and it tends to, when we get stressed out, our pain tends to rise, our blood pressures tends to rise, and we have shallow breathing. And so by doing deep breathing, we're combating that and trying to bring the body back into a natural balance. The R stands for rest, and I have a little side on there of distraction. We know it's really important to have proper rest following surgery, and that's really hard to do. Sometimes medications cause insomnia, weird experiences in the hospital. They don't get much sleep there, and when they're at home, it's really important to let our patients know they need to get the proper rest so that their body can heal. That's when the body heals. And distraction goes a long ways. If they can distract themselves from what they just had done, what you just did to them, distraction goes a long ways. If they can play with their dog or with their kid or a grandkid, if they can do deep breathing as a distraction, and that actually brings their body back into a natural balance, and they can rest a little bit more peacefully. The I in BRINE stands for ice. I always say ice is nice. Ice is awesome because it's a natural anti-inflammatory. It relaxes the muscles. It also provides a distraction to them. It numbs up the area. Oftentimes after a surgery like they have had, or being being in the hospital, those transition periods of sleeping to sitting to standing, standing to walking are really tough for the patients. I always have my patients complain, "Oh, it hurts to get up." Yes, it does. Throw some ice on there, numb up that area, and that transition period will be a lot easier for you. Plus, it helps relax those muscles. But just remember, ice is nice. All right. The N stands for nutrition and hydration. We know we have had great discussions with dietitians. We know how important nutrition is pre and post surgery. If they can remember that, if they can remember to take in adequate protein, if they can remember to eat a good balanced diet, oftentimes with medications, they're appetite depressors. Oxycodone especially is an appetite depressor. So if they can eat properly 3 meals a day, if they aren't hungry, if they can drink a protein drink, if they can drink plenty of water, it also helps prevent issues with blood clots if they're drinking plenty of water and getting the adequate nutrition that they need. And then the E stands for exercises and walking. we need to get these patients up and walking soon. That's what we've taught in the hospital, that's what you teach your patients, and that's what we try to teach our patients at home. Get up and walk. Exercises will help prevent blood clots, it'll help prevent pneumonia, it'll get the muscles back into a kind of a muscle memory type of a thing, and it really increases their ability to heal. I created BRINE as an easy way for patients to remember these simple tasks that they can do. The cool thing about BRINE, though, that I love is that my patients take an active part in their healing. They don't just sit back and say, okay, therapist, do your thing. Okay, nurse, do your thing. I can go to them and I can say, have you done BRINE today? When was the last time you ate something? When was the last time you did exercise? When was the last time you did deep breathing? And they're like, oh yeah, I've got to remember to do that because that can help me. Over the last 4 years that I've been using BRINE, I've had really good success in helping patients lower their narcotics in the home. Just by doing these simple things, because they take an active part, their body starts to heal naturally, and they can taper out those medications a little bit easier.
I love that. I love the active part. I don't know if you were there, I think you were, but in our conference 2 years ago, we were just talking about the attendees at one of the sessions. And we had just about every medical subspecialty represented that you can think of. But Liz Baker, pain psychology, said the person that we're missing is the patient. We didn't have a patient in the room on this particular case discussion. And I think with you that the patient should be an active participant in the care team of their own care and feel empowered to be that. And I think that this model really encourages that. And I also love that its foundation is in your expertise with post-surgical floor nursing and home health nursing. And if anybody understands the nuances of post-surgical aftercare, it would be somebody like you. So this is a wonderful program that we highly endorse and encourage patients to understand and to utilize in that post-surgical after period.
Yeah. Thank you.